So this can be, to some extent, an early warning sign of much more severe things down the road.
It does have an association, again, with some other chronic illnesses, more inflammatory-based illnesses.
This is Generation Health. Every week we bring you the latest in news, cutting-edge research, and time-tested best practices, helping you live a longer, healthier life. Across from me, Dante DiMatteo, PharmD, certified strength and conditioning specialist. How are you, sir?
Not too bad. How are you?
I'm good. I'm still coughing a little bit. We'll try and get through again without coughing.
I think I let my strength and conditioning certification, it may have lapsed. So we might be lying to the people.
Well, that's not good. We shouldn't lie.
We got to figure that out.
Yeah. How often do you have to renew your strength and conditioning specialist certifications?
I'm not sure. It might be like every 2-3 years.
Every 2 years?
I think we talked about this before.
We did.
Yeah.
Well, we talked about nursing license, I think.
But pharmacy license, it's way easier. You have to print a license. It's got to be displayed in the pharmacy. It's on your pocket license. So you're always reminded
when it is.
And it's every 2 years.
Okay.
But between renewing the store licenses and the DEA licenses and our own licenses and insurance recredentialing, it feels like I'm constantly renewing something.
Dude.
And so it was, in the NSCA, they don't really spam you with renewals.
Yeah.
Like they sent an email and then one thing in the mail.
Wow.
And I pretty much just,
ignored it. Josiah Schweinberg, third mic engineer. How you doing, my friend?
A little chilly.
I see that.
Got my coat on.
It's the same temperature in here as always.
What's cooler than being cold?
Ice cold.
Oh, gosh. All right, Dante, what are we... I'm Tyler Andrews. I should announce myself. Introduce myself?
Mm-mm.
Okay, never mind. Dante, what are we talking about today?
We're going to talk about gout.
I don't know a lot about gout, so I look forward to hearing about that. But first, let me tell you guys what's going on behind the counter. A few months ago, I was excited to talk about a trial for a medication, PCSK9 inhibitors, that can help reduce Lp(a) cholesterol, that would be the heritable portion, by 20 to 30%. Dante took great delight in raining on my parade and talked about another drug with far bigger results that was on the horizon. Eli Lilly made headlines when they published the results from a phase 1 trial of a new drug they're working on called lepodisiran. Lepodisiran is a single injection that in trials had an unbelievable effectiveness rating of up to 94% reduction of Lp(a) after 48 weeks after the injection. The trial consisted of 48 people with elevated Lpa levels. 12 were injected with a placebo. The remaining 36 were divided into 6 dosing tiers to see where they should all fall, ranging from 4 milligrams all the way up to 608 milligrams. Lpa levels were then tested periodically throughout the 48 weeks. The group receiving the highest dosage actually had undetectable Lp(a) levels for the first 40 weeks before they eventually climbed back to a mere 6% of what they had originally been. The second highest group, that getting 304 milligrams, saw a fantastic 75% reduction at the end of the trial. That this came from a single injection and was as durable in the body as it was is absolutely staggering. So, I stand corrected. You were correct. That is a phenomenal result. No safety issues have shown up during the trial, so Eli Lilly has already proceeded into phase 2 trials, and that should be concluded sometime in October of 2024. Stay tuned. We will definitely have more about that. And researchers in China have found a fascinating new detail in how the body reacts to periods of fasting. 25 obese individuals volunteered and were studied over 2 months while they used an intermittent fasting diet that utilized full fasting on specific days. Not only did the participants lose weight, about 17 pounds on average, but there was a substantial shift in the gut bacteria or microbiome, as well as in brain activity. Researchers used fMRI scans to spot changes in the brain activity in areas of the brain used to regulate appetite and addiction, and saw a reduction in activity there, meaning the participants felt less compelled to engage in compulsive eating. The bacterial changes were tracked via blood and stool samples, and they also showed marked shifts in specific bacteria strains that were negatively associated with executive function and willpower. While the researchers couldn't conclusively identify what was the cause versus what was the effect, the results were consistent and repeatable. Engaging in a diet that incorporates fasting changes the way your brain works and the microbiome that influences your brain. Joe was the first person I ever heard talking about the gut-brain connection, and that was a decade and a half ago. But every day, more and more research comes out reaffirming that connection. I think that is super, super cool. And it's interesting to see this as a specific type of dietary intervention that actually affects the brain pathways, the way the brain works. Mm-hmm. Do we think that this, we're totally spitballing here. Do you think that will be confirmed in other studies as well? If you're using just calorie restriction versus fasting, or do you think that the fasting in particular had something to do with this big shift?
It's hard to say.
Yeah.
Yeah, it's hard to say. There's tons of fasting research out there at this point. Looking at more, more hard outcomes. And a lot of those, obviously, when we look at weight loss and those sort of bigger ones, it's obviously not much better in a lot of cases, but in general, and even looking at more forward thinking studies like these, I wouldn't be surprised for something more.
Yeah. In general, it's a math problem of calories in versus calories burned. But if this has some impact on the way that your brain engages with addictive behavior, mm-hmm. that's really cool. Mm-hmm. That's really neat.
There's a lot coming out about, well, as you said, Joe Sr. was hot on the uptake then.
Yeah.
There's a lot about the gut brain link.
Yeah.
Which is what he used to talk about all the time. A lot of people, a lot of other naturopaths and certain things are making quite a name for themselves.
Yeah, you got to pay attention to that connection.
It's interesting.
Well, all right, let's talk about gout. What is gout? That's a nasty sounding thing. When I hear gout, I always think of Charles Dickens because I swear half of his characters had it.
Really?
Yeah. If you looked it up, that's I don't remember now off the top of my head, but I remember reading Charles Dickens in high school and multiple times hearing about gout. I didn't realize that it was still a thing.
What do they call it?
What do you mean?
Don't they call it a rich man's disease?
Yeah, arthritis of the rich.
What? Yeah. Why is that? What is it? What is it? What is it called? Why is it called that?
I believe it was more because it was reflective of the lifestyle mm-hmm. choices that the more affluent were able to make.
Right.
Higher in alcohol, higher in general food intake, and as we'll talk about, foods higher in purines and different sorts of exotic meats and organ meats and stuff that were, food products that were less available to, lower class, I would say.
That makes sense. Sense.
But okay. If I had to bet, more alcohol consumption amongst that crowd at that time.
That makes sense. Okay. So what is gout? Let's start there.
In a simple sense, it's just the deposition of uric acid, basically it mainly occurs in distal joints. So joints further away from sort of your center of mass, if you will. So it's this deposition of uric acid that essentially causes inflammation in the joints. There's an inflammatory response that ultimately leads to some nasty pain, swelling, and a whole host of issues to that specific area.
Okay, so in layman's terms, mm-hmm. deposition, you mean like depositing, mm-hmm. holding on to?
Mm-hmm. You think of it as literal as it sounds, as there are little crystals basically and little stones that are sort of left behind in those joints.
And it's in the joints furthest away from center of mass.
Yeah.
So hands and feet.
Yeah, more specifically, you'll see a hallmark look in the knuckles on your hands, and then also on the lower knuckle of your big toe. is another big, that's a very common area where you'll see that kind of hallmark look swelling of a gout attack.
And it's built up uric acid.
It is.
Okay, so what is uric acid?
Uric acid is ultimately produced when the body breaks down purines, or they're just natural substances. They're found in cells and they're found in many foods.
Okay.
So it's a byproduct of that process, again, of breaking down purines. And then our kidneys generally in normal conditions flush out that uric acid with no issue. But, according to, honestly, the Arthritis Foundation talks about this nicely.
Yeah.
And it's more than a waste product. There's obviously some negatives as it accumulates, as we've already said.
Sure.
And then on the flip side, there are some negatives when uric acid gets too low, I suppose. But we'll stay focused on the upper end of that.
Right. So most people don't have any trouble clearing their uric acid out of their body. It's a natural byproduct of eating and processing things. Your body produces some of it. So for most people, that's not an issue at all. But for the people that it is an issue, whether it's because they are producing too much, which could be a function of, you said, genetics,
definitely,
or lifestyle, or they aren't clearing it out properly, which probably would make sense. I guess that could be either lifestyle or genetics as well, or some combination thereof.
Definitely a combination.
Then it builds up, and over time, you said there's like crystals that form inside of joints or something like that?
Exactly.
Wow.
Exactly. And so over time that can, begin to degenerate and, cause, long-standing issues in a particular joint.
This sounds kind of like kidney stones or gallstones, of the buildup of something that is normally cleared out, but for whatever reason isn't clearing out. And over time it becomes a substantial issue. Is that a fair assessment?
It is.
Okay. So how is it diagnosed?
So usually you'll have some sort of symptom. Your doctor is not just measuring uric acid typically without a reason to do so. I mean, although uric acid, there's different correlations here as it can be a marker of other chronic inflammatory conditions. So that it certainly has, like we've said, a role in other areas, but your doctor's generally not just measuring that without a reason to do so.
Right.
So gout is symptomatic. So you might have some symptoms. You might, you might have some of the hallmark symptoms, or, the hallmarks appearance of swelling in that distal joint sort of the big toe. And then ultimately some blood work will be done, and they'll look at your serum urate or uric acid, and above 7 milligrams per deciliter is generally the cut point of diagnosis, more or less.
Okay.
And then they also will do in a lot of cases, I don't, I'm not the one diagnosing this per se, but they'll also do fine needle aspirations. And so they'll actually look at the fluid in the joint and look for the presence of these, monosodium crystals, they call them. And so they'll look at that. They'll corroborate that with the systemic symptoms that you might have. They'll look at this. They'll look at your serum uric acid level. They might even do some X-rays to look and see what's happened. If this has been went on a long time without you doing anything, there might be some chronic destruction, more or less, of the joints. Or again, this is certainly an instance where a good rheumatologist can help rule out something more serious. You might want to involve a specialist sooner than later. The diagnosis process for a lot of people is very simple. Walks like a duck, quacks like a duck. This is an instance where that's, this can be the case, but also it's not something where you wouldn't want to completely rule out being referred to a rheumatologist or somebody that deals with these sort of issues more frequently.
Because this is a big deal.
It is.
So is this one of those things that once you've got gout, you've always got it, and your joints are just always in pain at all times? Or does it come and go? What's the deal there?
Yeah, good question. It can take any one of those forms.
Okay.
I would say. And that's the thing. If you're if you're actively managing this, which we'll talk about different treatment options,
Sure.
you'll certainly find yourself in more of a situation where it's ebbs and flows, and you have more, you have 6 months where things are great, and then you might have an attack, so to speak.
Okay.
But looking at, more specifically at some of the types of gout, there's gouty arthritis. And so again, that's reflective of these acute attacks, and it affects, maybe one main joint, for instance. And then there's tophaceous gout.
Ooh.
And this is more of a waxy buildup of these yellow crystals in the joint. And this takes a long, long time to develop. And so from my understanding, maybe, you're not having attacks all the time, but there's this, if again, you haven't had your uric acid measured, not many people don't need to,
Yeah.
you haven't had overt pain, maybe you just think it's arthritis. And then sure enough, it amasses to this serious, difficult to treat issue.
Okay.
So, those are the general types. And then, as far as treatment goes, we can talk a little bit about that, but yeah, for the most part, you're going to be, as just on a level of principle, you're going to be managing gout attacks with different treatment options, lifestyle things, lifestyle changes, avoiding maybe certain trigger foods. And then you are, in most cases, going to be on a maintenance medication to, again, keep that
level down,
uric acid level lowered.
Okay.
Because the longer that stays elevated, it's going to be hard. You're hard pressed not to have
the buildup builds
right.
up. Mm-hmm. Okay. So we've talked briefly about it here. What are the genetics are genetics. You can't do anything about that. You've got your genes. Mm-hmm. So, I guess, if your family history suggests that gout is an issue, you should be aware of it. But for everybody else, what are the lifestyles that cause this to show up more frequently?
So a big one is obesity.
Okay.
So that's in a lot of cases, very difficult to treat, but that is a large risk factor here for gout. And then also, there are some medications and some other conditions that can lend itself to a greater likelihood of gout. And then, so an example of these medications would be certain diuretics. So hydrochlorothiazide is one that it's a commonly used blood pressure medication that oftentimes, can lead to this.
Okay. So if you are on blood pressure meds, like, what'd you say it was?
Hydrochlorothiazide, yes.
There's a higher chance that you will end up with some sort of gout.
Potentially.
Side effect.
I think if you've never had a gout flare, all of a sudden you are, maybe they look at, it's just natural to look at somebody's med list.
Right.
And also just like you would try to understand a picture of their everyday diet, if their alcohol consumption, what's their waist circumference, it just would fit right along with that.
Well, and it makes sense too that somebody on blood pressure medication will also likely, not all the time, obviously, but often have an obesity issue as well. Mm-hmm. So that makes sense that they go hand in hand. Anything else in terms of medication that we should keep our eyes open on?
So potentially, and again, not that you would want to stop using that medication per se. It's just, it falls in this, evaluation phase, but diuretics, specifically the one that we mentioned, cyclosporin is another one. Niacin.
What are those used for?
Commonly used for, niacin can be used for cholesterol lowering. Cyclosporin is an anti-rejection drug.
Okay. So that's not a lot of people that are going to be facing that one. But
yeah. And then also low dose aspirin would be one that kind of falls into this bucket as well. But these aren't, again, this is not a hard, fast rule to stop these meds if you notice that all of a sudden you have gout.
Yeah, we're talking about the chance that you might experience something is increased by this, but that certainly does not mean that you will. Mm-hmm. Okay. So other than the medications, you said obesity. Is there anything else lifestyle-wise that people need to be aware of?
Absolutely. So there are certain foods and drinks that, are more than likely to cause someone's serum uric acid to be higher.
Yep.
So red meat, more specifically organ meats and more gamey meats are the more likely culprits. Certain seafoods, shellfish, those are big ones. Alcohol, and then also sugary drinks.
Okay. So you're, and again, this is couching all of this very carefully. We are not saying that you shouldn't eat red meat or shellfish or anything like that. It's that those are higher in purines, I assume.
Exactly.
And then therefore your body creates more uric acid as it breaks those down.
Correct.
So you're talking about diets that are very high in those things over a long period of time.
Mm-hmm.
They're going to be the ones that are more prone to dealing with gout issues.
Exactly. And it honestly, it seems like the as far as making a stark change, you could say that you're better off limiting organ meats specifically and moving to, a little bit more ground meat instead of the organ meats, and maybe more yogurt or different forms of protein instead of always eating meat. So some sort of stepwise approach to limiting that. If you're even somebody that consumes a diet high in those foods to begin with, it's not like every single person.
Yeah. Organ meat is not a big thing these days. Although I have heard a lot about it being very popular, in the natural health world, because it is nutrient dense and it has a lot of things in it that you would want and you can get in a concentrated form, but maybe not eating liver every day.
Yep.
Okay. All right.
Yeah. Especially again, if your dad and your grandfather, and there's this history of gout in your family, you're going to have to potentially be a little more vigilant.
And you said sugary drinks. That's the other one. I hadn't heard that before.
Mm-hmm. So it's oftentimes higher fructose containing foods or drinks. With that said, high fructose corn syrup in the form of sodas and
is there any good high fructose corn syrup?
No,
I have not heard it associated with anything good ever. So
yeah, I don't know. It's sugar sweetened beverages.
Yeah.
With the availability of, hot take, I suppose, and for some people, but with the availability of all of these diet drinks that don't have these in it, I'm hard pressed to wonder why so many people are still drinking.
Because they taste better. That's why. All right. So that's where it comes from. That's who it bothers. So somebody's got this, whether because of lifestyle or genetics or a combination thereof. Uric acid has built up over time and they've developed these crystal deposits in their joints. And now they're having a flare up and it hurts. My understanding from the little bit of research I did is that it can be debilitating. It can be something that just puts you in bed until it passes. What can be done in the moment to help people with those flare-ups? Are there medications that help? Is there anything that can be done lifestyle-wise in the short term?
Yeah. So on the base level, you're always striving to make lifestyle changes. You're not going to maybe lose a ton of weight overnight, obviously. So all of those things and watching your diet and, striving to consume less alcohol or less of a certain type of alcohol, all of those things are happening at the foundational level. And again, it's more so this idea that there's an inborn error with the metabolism of purines.
Right.
That's kind of at the base layer of this.
Yeah.
And it's the dietary choices and those sort of things that can kind of put somebody over the edge or lend itself to an attack, but it's not going to be the end all be all. And so to recenter, you want to do whatever you can to resolve how hideous these flare-ups can be, in the shortest amount of time as possible. And so with that said, within the first 24 hours of symptoms, that's when you want to get started on, some of these different options.
Okay. All right.
So in general, if you can do that, you can clear the flare or the attack, so to speak, within 1 to 2 days.
Okay.
And maintain joint function and prevent additional complications and that sort of thing.
What are those? What are the steps you can take?
So definitely can ice So as soon as you notice this, you can begin to ice the area. That can help.
And that helps reduce inflammation? Okay.
Definitely. And just reduce pain.
Okay.
So these are just quick, easy ones.
Yep.
Fluids, not sugar sweetened beverages, not necessarily diet beverages, but just water.
Okay.
You want to do what you can to improve blood flow and, this is a good time to avoid alcohol.
So no Jack and Coke, drink lots of water. Okay.
And now to the more heavy hitters. In a more mild to moderate situation, if this is maybe one or a couple smaller joints, they'll often use NSAIDs as treatment. So this is ibuprofen, naproxen, and then also indomethacin is another prescription NSAID, which for a long time, had been considered kind of the gold standard NSAID for gout flares. Or depending on the situation, if those are contraindicated for any reason, you could consider a systemic corticosteroid, so something like prednisone, which can help. In more severe or in more instances of severe pain or multiple larger joints that are affected, you might see a combination of medications being used. And this would be, again, NSAIDs, so ibuprofen, naproxen, indomethacin, or something called colchicine, which is Colchris, the brand name. It's been around for a little bit, been around for a good while at this point. It's FDA approved for the treatment of acute gouty arthritis and can be used in it's really used for the short-term prevention of additional flares. During the initiation of another class of medications, which we'll talk about. So you're treating it with the anti-inflammatories, whether that's maybe an injection, oral NSAIDs, oral corticosteroids like prednisone.
That's all to reduce inflammation.
Yes, and to try to get somebody out of pain and just kind of nix this thing as soon as possible.
Right.
And then while that's happening, again, if it's a more serious case, you might start something like colchicine, which is to hopefully prevent additional flares. So while you're treating this acute flare, maybe you add something like colchicine, you're also looking at, your clinician is looking at who would be a good candidate to initiate more of a maintenance therapy at this point. Because you don't just want to always be reliant on, well, it'll be fine. I'll just take a couple steroids for a few days and I'll be good to go.
Yeah.
Well, you still have to, again, address sort of this underlying issue that we've talked about. And that's that elevated uric acid that's ultimately led itself to these depositions in the joints. So who is a good candidate in this case? So at this point, if you've had multiple attacks or if you've already been established to have gouty arthritis, then you would be a candidate for one of these medications. If you have 2 or more attacks per year, that was a cut point at one point. And then there are some other instances where that would be indicated: chronic kidney disease, stage 2 or higher.
Somebody who has gone to the doctor, they've had an acute attack, they've been prescribed NSAIDs and colchicine, whatever else. The longer term solution or actions that a practitioner is going to probably suggest are.
Yeah. So while managing the acute attack is obviously of utmost importance at that time,
right,
you need to be thinking about the long-term outlook of this, because while you can manage flare after flare after flare, which you'll ultimately might have to do,
right,
you need to go one step further. And not that you're going to cure this by this class of medication that we're going to mention, but this is the kind of the gold standard at reducing that serum uric acid to a level that matters.
Okay.
And so the xanthine oxidase inhibitors, which that enzyme in particular, by inhibiting that, you essentially just, reduce the amount of uric acid that's being produced.
That makes sense.
It cuts right to the,
that's
to the
nice.
part that matters.
That's nice to have a medication that does exactly what you need it to do.
Exactly. So allopurinol has been around for 1 million years.
Okay.
That's the one that we see most commonly. Uric or febuxostat, that one has been around not quite as long, but I don't see a ton of that at this point.
Yeah.
Just because allopurinol, it's generally well tolerated. It's inexpensive at this point. And there's a lot of flexibility with the dosing,
Okay.
so it's, I know a lot of people are reluctant to maybe get started on something like that in a maintenance sense, but with how vicious this can be,
Yeah.
it's a viable option. So you'll in general, you'll usually start at a very low dose and you'll titrate sort of as tolerated, and you will have your serum urate looked at frequently to see if you're moving the needle.
Right. Okay. And because you don't want to just let this ride, because you will have another flare up and it will happen at the most inconvenient time possible. It's not like it waits for you to go on vacation.
Right.
Or maybe it does, and then you're stuck in bed.
Listen, I was supposed to, so at the church that I'm a part of, I was supposed to go on a missions trip with my pastor. And the day we're supposed to leave, he's like, I can't go. He's like, I got gout.
Yeah.
Couldn't, it was like so inconvenient. He was supposed to lead the trip. And the group of us had to like band together, like lead the trip, but it was super inconvenient.
Yeah. So don't just let it ride. Take some action.
Yeah. And like I said, you let this kind of ride and this becomes a chronic gout.
Yeah.
Again, we talked about kind of the hallmark look of certain joints that can get worse to the point where there's almost a deformity that can start to occur as the cartilage and the bones in that area are just, sort of changed to the negative by the presence of the uric acid deposits. Kidney stones, you're at a higher risk of kidney stones because those urate crystals, they don't just go to your joints, so it is related. It is 100% related.
Wow.
Kidney disease and therefore kidney failure, so you let these urate crystals build up. They manifest as these deposits. And then also they can damage the normal functioning of your kidneys.
So this can be, to some extent, an early warning sign of much more severe things down the road. Wow. And
again, a conversation for another time, but elevated serum uric acid, not that we're saying that this needs measured widespread across the board.
Right.
It does have an association again with some other chronic illnesses, more inflammatory based illnesses. And like Josiah said, there's the emotional, psychological, practical issue with dealing with these attacks that will drastically change what you're able to do in your daily life to the point where you can't go on a trip, for goodness sake.
And seemingly coming out of nowhere.
Yeah.
Yeah. So my two questions is, one, with the, emotional damage that it may cause, is gout something that people should be embarrassed about because it's so commonly known as, like this rich man's disease, or like it's often, obesity is one, or, like all these things. So people are like, oh, I can't tell anybody. But then when we talk about that it's genetic, there's not really much you can do about that. So it's not necessarily something that people should be embarrassed of.
I think that's a really good question. I think that it sounds like, a stigmatization of certain disease states, certain conditions would make you less likely to even seek treatment.
Yeah.
For goodness sake. That's inherently a barrier to doing what you need to do. You're obviously not going to bring it up to family. You just kind of get through it if it's not super bad.
Yeah.
And then, because of, you hear of the historical view of this particular disease, and you hear about the risk factors, and it's a function of what am I eating? And I have a little excess body fat, and this is my fault. And and certainly there's a level of control that you have over, maybe flares that are to come. But again, at a very baseline level, whether it's a genetic cause or something else, there's an inherent inborn error of metabolism when it comes to, the
way it's
purines
processing.
and uric acid and the obviously the byproduct of that. Yeah.
And it's not something to be ignored.
Definitely not.
So let's pretend, Miriam has come in. She's picking up her first prescription for colchicine. She's got some excess body weight. What is it that we would suggest for her? Are there alternative supports that can help? Is there lifestyle? There's obviously some lifestyle changes that need to be made. What is it that a rheumatologist or a practitioner or even just somebody who's well-informed and once her best would suggest?
Good question. I mean, like anything, this is a holistic approach, to management. So getting over the hump, you want her to get over the hump with the acute attacks.
Right.
Do what you need to do on that standpoint. Consider some of these other options. There's probably, if these attacks have been, again, on a more frequent basis, you want to try to remain as compliant as you can with one of those new meds that maybe they started.
Mm-hmm.
But additionally, continue to exercise.
Yeah.
I mean, we're always talking about the old exercise. That's a prime example. I'm not sure that it's doing something specifically to the joint or the presence of the urate crystals, but from my understanding, you're not going to do any additional harm by continuing to exercise, although it might be very difficult. So in the same sense that you would be managing low back pain or a shoulder injury or a foot injury, those same principles would apply as you're dealing with an acute attack or in the aftermath of an acute attack. You have to do what you can to tolerance, but there are very rare instances where we would say, just lay down for 5 days. That there's very few conditions where that's the ultimate solution. So,
right.
So that's a big one. There are definitely some, we talked about the dietary implications. So avoiding certain meats, organ meats, high fructose corn syrup, lowering sugar in the diet, which we could advocate for anybody to do.
Right.
And a lot of these are, these are hard changes to make. There's no denying that. Losing weight, hard change to make, something that you're going to have to take. That's going to take time, and there's going to be plenty of ups and downs. In addition to medications, I don't really think that it would be harmful to consider a handful of different supplements. There are a lot of the supplements that we have specifically, they contain things like turmeric and tart cherry extract. And there's a celery root extract and certain kind of heavy hitters in the supplement world, if on a quick search, that you'll see may or may not have some benefit in terms of gout relief.
Yeah.
So you can ultimately do those things in tandem with what you're already doing. Again, I don't believe that something like gout relief or one of the products that we have, if your uric acid is, 8, 9, I don't know that those are going to necessarily be the things that put you into, below 5 or below 6, which is often the target here. But doing those in tandem, if you have an attack or if you just, like doing some additional anti-inflammatories, those are certainly options.
Yeah, it makes sense. That makes sense. It's not a pharmacological therapeutic dose, but anything to help reduce the chance of dealing with these flare-ups is worth considering. Okay. All right. Anything else? So we're talking lifestyle, dietary changes. So exercise, motion is lotion is what I heard a physical therapist say once.
Mm-hmm. But that's a hard one to tell somebody to do.
Especially when they're in acute joint pain.
Yeah.
But to the best of your ability, keep moving and avoid heavy red meats and alcohol and sugary beverages.
Mm-hmm. Yeah. I mean, it's unfortunate if you're again predisposed to this, you were dealt a bit of an unlucky hand with having to deal with this. If you're a big craft beer drinker, you just maybe one of those things that you're going to have to find an alternative or just pick your spots. That's just the reality. Or if you love organ meats and you eat a ton of them, maybe it's a, bit more of a balanced approach there. But
fair enough. Gosh, I wish that's one of those things. And am I correct, before we wrap this up fully, am I correct in thinking that this is one of those things that you make all the lifestyle changes, you lose 100 pounds, you never eat red meat, you never drink alcohol, you never drink sugar sweetened beverages, you take your meds, and yet you still might have a flare up.
Mm-hmm.
Because it just, once it's built up to a point, it's just kind of there, always lurking in the background.
Or if it's genetic, like you're saying.
Yeah.
Mm-hmm.
I'd be curious to see, I'll look up after this is over to continue my research, but I'd be curious to see how many cases of gout are, hey, this is just a one time versus it is, genetic.
I don't think it's ever just one time.
I don't believe so.
Once it's there, it's there.
Mm-hmm.
Dang.
So
I'm sorry.
Right. It's like there's no cure per se. You're managing your uric acid levels in the blood, and you're managing attacks when they occur, and you're decreasing the frequency of attacks.
Yeah.
You know?
Gosh. I was really hoping that there was some miracle cure that I hadn't hit across, and that you're going to be like, oh no, here's the thing. You just need to take 2 of these and it'll never happen again. But that's not the case. So for uplifting, happy things, Josiah, do you have something uplifting and happy you can share with us? Maybe bring this show out on a happier note?
I don't know if it would be uplifting, but it's definitely reflective.
Oh,
so
all right. What do you got?
Continue on. So we are a month into 2024,
give or take.
Yeah. So we're about a month into 2024. Every year our church starts with prayer and fasting. So we talked at the beginning of this episode about fasting. And I always start the year trying to do a Bible reading plan.
Yeah.
Like a Bible in a year plan. And so I was reading earlier, so back in Genesis, Old Testament, and just the Tower of Babel story. So this is just before humanity has spread and multiplied throughout the whole world. God gives humanity this very clear command: hey, go multiply, fill the earth. And here everyone stays in one spot, and they begin to build this tower. And they say in Genesis 9, here, let me pull the verse. Genesis 11. See. Then they said, come, let us build ourselves a city and a tower with a top in the heavens, and let us make a name for ourselves. And the Lord came down to see the city and the tower which they had built. Lord said, behold, they are one people, and they have one language. This is only the beginning of what they will do, and nothing that they propose to do will be impossible for them. Let us go down and confuse their language. Anyway, so I'm reading this again, the beginning of this year, and I'm thinking, here's a group of people that are working together in unity, and God's like, nope, you shouldn't be doing this. And I'm like, why? Why would that be the case? And again, like I said, God gave them this clear command: go into all the earth, multiply, and they're staying in one spot, building a tower unto themselves.
Yeah.
And that is the biggest reason, is that it wasn't this tower wasn't to glorify God. It wasn't to help people, but to make a name for themselves. It was a desire for self-glory, self-recognition, praise of self. And if there's anything that's ever prevalent in our world, it's self-centeredness, self-seeking, self-promotion. Even when we were off air and preparing for this show, we were looking at some analytics of our current viewership and talking about how, man, I can't wait until we just need more viewership. We need more of you to share. We need more of you to like, and all of that is not necessarily bad,
right?
Because we are building to help other people. And so my encouragement, or my uplifting kind of end of show here, would be to make sure that whatever you're building in your life, whatever you're working towards, it's not for your self-promotion, it's not for your self-image, but that it's to help other people. So instead of building a tower to yourself, build beyond yourself and to help people. And that's what this show's all about. It's what your dad was all about.
I love that point, that it's not, God wasn't upset that they were working together.
Correct.
He wasn't even upset that they were building something. It was the reason that they were building the thing. It was not about helping anybody else. It wasn't about glorifying God. It was about self-promotion. And that's a problem.
Mm-hmm.
Yeah, that's a good point. And to that end, if you like this show, you should share it with other people.
Exactly. Yes. That segues nicely.
Yeah. No, but seriously, we do appreciate and value when you guys share the show. That is the best way. If you know anything about analytics and the way the internet works these days, all of the big gatekeepers like to make sure that they only show the things that they think you're going to like. And the best way to get around that is for you to share the show with people that you think will like it, because YouTube or Rumble or whomever probably isn't going to do it voluntarily. So do us a favor, share the show. If you think there was something valuable in this, if you know somebody that's dealing with gout, share the episode with them. Help them to maybe get a better handle on what's going on in their life and in their body, so that they can make the changes that they need so that they can be more productive and help other people. what else we got? I guess I should wrap this up. The products that we mentioned, the gout relief, the UA Redux Essentials, those are available on our website, askjoedimatteo.com. That is also where you can find supplements for all sorts of other issues. You can find past episodes of this show. You can find our email newsletter so you know when things go on sale. You can find episodes of the show that started all this, the Ask the Pharmacist show. If you didn't know what we're talking about, Josiah just mentioned it. It's all there on our website, askjoedimatteo.com. If you've got a question that you want answered, maybe it's something about gout or some other condition, drop us a line, questions@askjoedimatteo.com, or you can leave a question down on the comments section of the video, or however you want to email us. We love hearing about it, and we will try to work it into the show. Show notes, anything we referenced will be available down below. And that's it. Josiah Schweinberg, engineer extraordinaire. Michael Deppish, our editor. Joyce Gibb, our nurse practitioner who handles private consultations. Diane Silverman, who handles product. Terry does scheduling. Cecilia does distribution. That's Dante DiMatteo, PharmD, no longer certified strength and conditioning specialist. I'm Tyler Andrews. Thanks so much. We'll see you guys next week.